Hi, I wanted to take a moment to address the community about our collective task at hand in response to the COVID-19 outbreak, also known as the novel coronavirus. First, I want to talk to you not only about the facts, but where to find the facts. Your first source of information is rarely your best source of information. Quality facts can be found at the CDC, Center for Disease Control website, and the website of the World Health Organization, also known as the WHO. Suddenly, social media seems to be full of doctors, but I can assure you that this is not the case. Your friends, although I'm sure they are great people, they did not get their medical degrees overnight. Furthermore, while we may live in an increasingly politically polarized society, I can assure you that this virus is not going to care about who you have or will be voting for. Now is the time to follow the advice of our world's leading health professionals. The information I will share in this video originates from the World Health Organization and the Center for Disease Control. By the time that this video is published, the statistics I'm about to share are probably going to be outdated. This is a rapidly advancing situation. As of Tuesday, March 17th, there are 6,500 confirmed cases of coronavirus nationwide, as well as 100 deaths. This includes, unfortunately, 2 people who have passed here in the state of Indiana. According to State Health Commissioner Chris Box, it is likely that over 60,000 Hoosiers have already contracted COVID-19. We have about 6,000 hospitals nationwide with the capacity to hospitalize a total of 1 million people simultaneously, according to the American Hospital Association. However, the accepted projections for COVID-19 in the United States include between 217,000 to 1.7 million deaths, between 160 million and 214 million Americans infected, requiring anywhere between 2.4 million to 21 million hospitalizations. According to Andy Slavitt, former National Health Advisor, most of the major hospitals in the United States are planning to be overrun just 1 week from now on March 24th. I encourage everyone, please, take a moment and listen to what regretful Italians had to say to their former selves about underestimating this pandemic.
Perché quello che rischi non è il solito raffreddore.
Vediamo immagini dalla Francia, dagli Stati Uniti, preoccupanti, di persone che stanno prendendo sotto gamba la cosa. È un problema più serio di quello che gran parte del mondo crede.
Non è pessimismo cosmico.
Quello che sta succedendo è molto più grave di quello che ti immaginavi. Tu capirai che solo il fatto di poter respirare anche solo l'aria di casa tua, insomma, è già una grandissima cosa.
We must take responsibility as individuals for the good of society at this time. This includes the social distancing that we've heard so much about, keeping 6 feet of distance, and please stay home unless it's absolutely necessary. I highly encourage everyone listening to this video to go and read the information that has been made available online at the World Health Organization website and the CDC, Center for Disease Control. Every expert agrees that the situation in the United States will escalate rapidly over the coming weeks and months. Some estimates suggest that Americans will have to quarantine anywhere from 8 weeks to 16 weeks, which will have a devastating impact on our economy, and most importantly, poor and working people who are already barely scraping by under ordinary circumstances. As such, a community organization I'm proud to be a member of, Organized and United Residents of Michigan City, has collaborated the following lists of demands and a short-term vision on how to best help the poor and working people during this time of unprecedented crisis. Demand 1, no rent and no debt. Local officials must negotiate with landlords, local banks, and utilities to stop charging rent, mortgage, and fees during this crisis. Cities must not charge for utilities and must stop issuing fines. Once the crisis passes, suspended payments should be totally forgiven. 2, emergency healthcare. Local healthcare providers must offer free COVID-19 testing, treatment, and healthcare for every resident. Medical bills must be suspended. Once this crisis passes, suspended payments should be totally forgiven. 3, housing for all. I applaud Lake County for immediately ending all evictions. We must open up unoccupied homes and buildings to anyone who needs shelter, and utilities should be restored immediately. 4. No work. Employers must suspend work obligations. The state must immediately institute emergency unemployment benefits for all hourly and salaried workers laid off during this crisis. Local governments need to work with business owners and assist workers. 5. Nobody starves. State and local government must guarantee food and create a delivery system for essential items, especially for people without transportation or those who must self-quarantine. 6. No jail. End bail for the county jail, release people in jail for nonviolent offenses, and end cooperation with ICE immediately. As a final message, please take this situation seriously. All of the world's leading health officials are urging us to do so. The actions we take at this time really can save lives. Thank you.